we've seen the whole picture. And it seems, from what I understand, that the whole picture may not be currently available for us to see and appropriately scrutinise. So I wonder, Dr. Spicer and colleagues, if you could recap sort of where we are in the process at the moment, what the sort of current steps are that you're taking, particularly with partners such as Imperial, the TDA, whoever that might be, whoever else you're working with, and when we can expect to see a next proposal about, particularly around what Charing Cross, the Charing Cross Hospital, Charing Cross site will look like.
Thank you very much, Councillor Vaughan. So I can just briefly answer the points that you asked me to in terms of plans as they stand, where we are with the IMBC. So, in summary, as you have heard from Imperial on other occasions, there's a integrated site strategy for the different Imperial sites. So the St Mary's that we've been discussing will be a major hospital, also the major trauma centre and the stroke centre. Hammersmith Hospital will be the specialist hospital and accept emergencies in terms of cardiovascular emergencies, including heart attacks and other specialist emergencies. It will also have continue to have its 24-hour urgent care centre, and Charing Cross Hospital will be the local hospital, and it is designed to meet the needs of the local population in terms of enabling them to stay independent, encouraging their self-care, supporting carers of patients, and providing education for them. It will also offer the range of outpatients that it currently does, although, as we've discussed this evening, the format of the outpatients will be at times different, so we will be encouraging the provision of one-stop shops, so that instead of a patient needing to come to the hospital on a number of occasions to have investigations and then subsequent outpatient consultations, we will try to get as much done in one go. We will also reflect, as has already been mentioned by Mr. Naylor, the fact that many patients have multiple conditions, and we will operate situations where instead of having a single thing looked at, the broad presentation that they have can be addressed. And we will have an increasing number of specialist but rapid access clinics based on the clinic that we already have operating in Charing Cross in terms of frail and elderly patients who can be assessed and investigated on the day, plans made, but they are able to return home to their own homes. I suppose two other aspects of this that I would like to highlight. One is that this is very much part of an integrated approach to healthcare in Hammersmith and Fulham. It will be linked both to the hubs that we have in the north of the patch and the hub that we are developing in the south of the patch, and the 30 practices, so that there will be a single information platform. And some of the problems we have also discussed about outpatients will be precluded by that. So things like outpatients' letters and referrals will be a thing of the past, because when you have the same IT platform, you actually don't have to write a letter, pop it in the post, and then get another letter back. It will be on a single platform. But the other integration is with community services, social care and mental health services, so that all those services will be on site and available to patients. The last thing I would like to emphasise about, second from last, is that it will have emergency care facilities in line with the KEO report and a 24-hour urgent care centre. So it will be taking urgent and emergency cases, and the last aspect is that, as we have heard, workforce is a continuing issue within North West London and London as a whole, and so it will play a key role in terms of workforce development, training, and enabling workforce to work both within the hospital and in the community. So that's the outline of what the local hospital will be in terms of where we are within the implementation business case. So the implementation business case collates all the business cases that we are preparing across North West London. That is for all the acute facilities, all the hubs that are happening in the communities, and for the local hospitals. It therefore is coordinating across 8 CCG areas and 9 acute trusts. So the process that has taken place with the Imperial business case is that has been linked in with all the other business cases. As you will imagine, this is a complex process and has taken from the last time we spoke to you about it, and the current timetable for the completion of it is now the end of this month. By that point, the implementation business case will be a draft implementation business case and will be submitted to NHS England, and the provisional timetable for that is mid-March this year. There is, following that, a process that is, to a certain extent, yet to be defined. Clearly, this is a complex document, but the other issue is that we talk about it as if there are common things called implementation business cases. Because of its complexity and the breadth of it and the kind of quantum of money involved, it will inevitably involve NHS England, the Department of Health and the Treasury, and it will almost inevitably go through a number of iterations before we have a finding about whether we can proceed with the implementation in the way we plan. So the dates that I'm about to give you are less firm than the first two I gave you. Implementation is likely to begin the financial year 16-17, and implementation is likely to be complete between 2020 and 2021.